Today, we'll explore the 5 supplements designed to cure erection dysfunction in older men. Omega-3s. Omega-3 fatty acids are a maybe when it comes to protecting your heart and your erections. The research goes back and forth about whether fish oil supplements are really helpful for the heart. If the scales tip toward them being helpful to your heart, then your erections may benefit as well, explains Brambat. That's because heart-healthy changes are geared toward improving blood flow and increasing the size of blood vessels, he says. Your penis has some of the smallest blood vessels in your body, meaning they're easier to get clogged up. And impeded blood flow is bad for erections, so anything that improves blood flow is good. At first, it might not make sense that many blood pressure medications list erectile dysfunction as a side effect, he adds. That's because they modulate the way that blood vessels open and close, which can reduce flow overall, especially down south. By contrast, omega-3 fatty acids can have the opposite effect because they lower inflammation that might be affecting blood vessels, while also reducing blood clotting. That can help boost your blood flow. While you can get your omegas from supplements, getting them from foods such as fatty fish is your best bet. L-arginine. L-arginine is an essential amino acid that can be good for both heart health and erectile issues, Brambat says. In fact, a study in the journal Andrology found that patients with severe or complete erectile dysfunction had L-arginine levels that were significantly lower than that of men with milder forms of ED. L-arginine is broken down by the body into nitric oxide, a smooth muscle relaxer that allows for more blood flow to the penis, which is important for erections. Drugs, including Cialis and Viagra, block the breakdown of nitric oxide in the body, so there are higher circulating levels to help with erections. L-arginine is found in most protein-rich foods such as red meat, poultry, beans and dairy products, according to the Mayo Clinic, which has marked it as generally safe but cautions people who take blood pressure meds to talk to a doctor first. This is good advice for any supplements if you're on blood pressure medications, Brampat says. That's because a product like L-arginine can reduce your blood pressure, which is great if it's a bit too high, but not if you're already bringing it down with meds. In that case, you may see a sudden and dramatic drop in pressure that could cause you to faint, or, in extreme cases, have a stroke. If you're not on those meds and want to try the amino acid, Brambat suggests starting at a dose of about 6 grams a day to see how you tolerate it. In some people, the supplement can cause side effects, including nausea, abdominal pain, diarrhea, and bloating. L-citrine is another supplement that, like L-arginine, may help with stronger erections. This is because L-citrine is converted in the body to L-arginine, explains Peter Sambali, Maryland, assistant professor of urology at Rush University Medical Center in Chicago. L-citrulline can also aid in the production of nitric oxide. Nitric oxide is involved in vasodilation, which is the widening and opening up of blood vessels, which can begin and maintain the erectile response, says Michael Eisenberg, Maryland professor of urology at Stanford Health. A 2001 study published in Expert Opinion Pharmacotherapy states that NO is the principal agent responsible for relaxation of penile smooth muscle. Just for your information, penile erection is a vascular phenomenon that directly results from smooth muscle relaxation along with arterial dilation and venous restriction. Some studies suggest that men with vitamin D deficiencies are more likely to have erectile dysfunction, says Dr. Brambat. That may be because low levels of the vitamin are associated with diseases like hypertension, coronary artery disease, and peripheral vascular disease. Basically, blood flow issues that affect your system can also raise your risk of ED. Although you can get some vitamin D from foods including salmon and eggs along with sunshine, most people in the US are lacking the vitamin, especially if you live in the northern part of the country, says Brianna Elliott, RD, a coach at nutrition counseling service Evolution Eat. She adds that the longer you maintain low levels, the more effects you might see, including potential ED. But how much you should take is a moving target. The National Institutes of Health recommends 600 IU, while the Endocrine Society suggests much higher levels of up to 2,000 IU daily. This would be a good topic for your next doctor visit, Elliott says, noting that it's easy to test for vitamin D levels And from there you can get a recommendation about dosage amounts based on that information. Another supplement that is good for overall health and wellness, including erectile health, is folic acid or B9. Some research has linked improvement in sexual performance with folic acid supplementation, which lowered levels of the amino acid homocysteine, explains Tsambali. Homocysteine levels were previously found to be higher in men with ED than their counterparts who were not suffering from ED. Despite the fact that there are some supplements that may help with erections to a certain extent, supplements are not held to the standards of pharmaceuticals. Always choose supplements with a third-party verification, like NSF or USP. I always attempt to temper expectations when utilizing supplements for sexual performance, says Tsambali, and keep in mind that any supplement that has effects also likely has side effects. Pharmaceutical testing reveals those for approved drugs, but supplements don't undergo review in this way. Make a video which covers all this text.